Hello, my name is Jose Diaz-Miron. I'm one of the pediatric surgeons at Children's Colorado. I'm here to talk to you about a recent quality improvement campaign that we had for appendicitis management. Appendicitis is a common problem in the pediatric population. At Children's Colorado, we evaluate hundreds of children for abdominal pain, and many of these have appendicitis as the reason for abdominal pain, resulting in an average of 650 appendectomies per year over the past 5 years. The typical workup for someone with suspected appendicitis involves a physical examination, laboratory, and imaging tests. The classic presentation for a patient with appendicitis includes periumbilical pain that migrates to the right lower quadrant. Usually, there is associated nausea, vomiting, fevers, and anorexia. Laboratory tests include a CBC and inflammatory markers, and the most common imaging modality is a right lower quadrant ultrasound. At Children's Colorado, the yield for diagnosing appendicitis with this imaging modality is very high due to our skilled ultrasonographers and radiologists. However, occasionally pediatric surgeons evaluate patients that may have an atypical presentation for abdominal pain or ultrasound findings that may be equivocal. As surgeons, we try to differentiate appendicitis from other causes of abdominal pain, including gastroenteritis, mesenteric adenitis, constipation, and menstrual-related abdominal pain to minimize unnecessary operations in children. In instances where the patient presentation is atypical, or the ultrasound findings are equivocal, or when the ultrasound findings do not support the patient's exam, surgeons usually request additional axial imaging in the form of a CT scan or an MRI. At some institutions, national trends for axial imaging have shifted to rapid sequence MRI of the abdomen for patients requiring advanced imaging to diagnose appendicitis. However, we were noted to be outliers in underutilizing this radiation-free imaging modality for appendicitis, compared to these other national trends. Prior to our study, the annual average of CT scans and rapid sequence MRIs for acute appendicitis were 240 and 5.6 respectively. And because CT scans have innate radiation associated with its use, we developed a quality improvement campaign designed to understand stakeholder perspectives for axial imaging tests for appendicitis, to develop an initiative that could help us increase the number of rapid sequence MRIs, while at the same time decreasing the number of CTs for children with suspected appendicitis. We interviewed several stakeholders involved in evaluating patients with suspected appendicitis, including providers from pediatric surgery, emergency medicine, imaging technologists, and parents. To our surprise, we noted most of the involved stakeholders, including some of our radiologists and imaging technologists, were unaware of an active radiology algorithm in place for several years that sought to identify ideal candidates for rapid sequence MRI axial imaging for appendicitis management. This QI campaign was great at creating awareness through the interviews themselves and through visual aids posted at strategic locations throughout the hospital for this radiation-free axial imaging modality for patients that meet criteria for advanced imaging. Since the start of our QI campaign in May 2021, we have noted a reduction in CT scan utilization by 41% and an increase of 851% in the rapid sequence MRI use. We have correlated all CTs and rapid sequence MRIs that were read as positive for appendicitis with the final pathology evaluation of the appendix. In all instances, there was confirmation of appendicitis by pathology. We continued to underutilize this imaging option, and now we have noted that the barrier to rapid sequence MRI use has shifted from lack of awareness to logistical barriers in obtaining rapid sequence MRIs, since MRIs are not offered at all hours of the day, and from perceived difficulties with the ease of ordering this imaging modality. Our findings were presented at the American College of Surgeons Clinical Congress meeting this year, and the manuscript detailing the conception, implementation, and impact that the quality improvement campaign has had at our institution is currently in the final editing stages. In sum, rapid sequence MRIs for the diagnosis of appendicitis has improved drastically at our institution after our campaign. This imaging modality is feasible, accurate, and radiation-free for patients that qualify for further axial imaging when the ultrasound findings are equivocal, or when the physical exam findings are discordant with what we see either with laboratory or imaging findings. For more information, please contact our pediatric surgery office.